Okay, thank you. It's my honor to discuss the KEYNOTE-905 study, and this study is a randomized phase III clinical trial, and the patients with muscle-invasive bladder cancer, clinical stage T2 or T4 disease, N0, M0 disease, were recruited, and these patients should have the cisplatin ineligible disease or deny to receive neoadjuvant cisplatin-based chemotherapy. And the patients were randomized to two arms. The one arm is the radical cystectomy and lymph node dissection, then observation till clinical outcome comes, and the other arm is patients were treated with neoadjuvant EV and Pembo. Then after 3 cycles, the patients will undergo radical cystectomy and lymph node dissection. Then there is another adjuvant treatment phase, including 6 cycles of EV and 14 cycles of Pembo. So this is a randomized phase III clinical trial, and the key clinical primary endpoint is event-free survival, and the key secondary endpoint is overall survival. And the results of the KEYNOTE-905 is very important and very profound, because the hazard ratio of EFS is 0.4, and the hazard ratio for overall survival is 0.5, which set a new benchmark for the neoadjuvant chemo and immunotherapy in muscle-invasive bladder cancer. And we are glad to see nearly 40% of patients were recruited outside the United States and the European Unions. And in the Asian region, we have patients recruited from East Asia and also from the Southeast Asia. And in this study, I think the most intriguing results is the high PCR, pathological complete response rate. More than 50% of the patients get the PCR after neoadjuvant EV and Pembo treatment. So this study opened another important clinical question in the future. So can we spare the blood for those patients with super response to the EV and the Pembo? And also in this study, we also see significant improvement in the overall survival for these kind of the patients. So the next question is how to precisely give the length and the intense of adjuvant treatment in patients with different response to the neoadjuvant EV and Pembo.